That zero premium Medicare Advantage plan you keep seeing advertised can still legally expose you to $9,850 in in-network out-of-pocket costs in a single year in 2026, according to CMS. A typical Medigap Plan G, by contrast, leaves you on the hook for only the $240 Part B deductible if you stay in Medicare's rules. I read the fine print so you don't have to. So which one actually costs less? And for whom? The answer flips completely depending on one thing about your health, and I'll show you exactly where the line sits. Here is why this decision costs or saves real money. For a beneficiary with one or more chronic conditions who regularly uses specialists, cost modeling shows Medigap Plan G runs $3,100 to $1,400 per year cheaper than Medicare Advantage, once copays, coinsurance, and prior authorization denials are counted. Stretch that across a decade of high-use retirement, and staying in Advantage can cost roughly $25,000 to $35,000 more than switching early to Medigap. The cruel part is that the more you need care, the more the math tilts, and the harder it becomes to switch, because Medigap guaranteed issue rights generally expire 6 months after you first enrolled in Part B. At a glance, these are two opposite philosophies. Medigap Plan G costs more upfront, averaging about $165.85 a month at age 65 per 2026 figures, but wipes out almost all cost sharing, leaving you the $240 Part B deductible and access to any doctor nationwide who accepts Medicare. Medicare Advantage flips that. The average plan premium is about $14 a month. But you trade that saving for networks, prior authorization, and an in-network out-of-pocket maximum capped at $9,250 in 2026. Low premium versus low risk. That's the whole fight. Medigap Plan G supplements original Medicare rather than replacing it. So you keep original Medicare as your primary coverage. According to CMS 2026 figures, Plan G covers virtually all Part A and Part B cost sharing, meaning your main annual exposure for covered services is just the $240 Part B deductible, plus your premium. It suits people with chronic conditions or anyone who wants to see any specialist in the country without asking permission. The catch you'll feel every month is the premium. But the payoff is that a bad health year barely moves your bill. Here is Plan G's biggest edge. Original Medicare on its own has no annual out-of-pocket cap and charges you 20% coinsurance on Part B services after the deductible, so a stroke or cancer diagnosis can produce open-ended bills, per CMS. Plan G closes that gap almost completely. Your covered service exposure stays around the $240 Part B deductible, even in a catastrophic year, based on 2026 cost modeling. That's the difference between a $240 year and a $9,250 year. For someone with real health needs, that predictability is the entire product. Plan G's real weakness isn't the plan, it's the timing. Medigap guaranteed issue rights generally expire 6 months after you first enrolled in Part B, according to 2026 research, and after that window insurers can medically underwrite you. For someone at 67 with diabetes and kidney disease, that can mean quotes of $190 to $210 a month, instead of the $165 on 85 being available at 65, and in some states, an outright denial. You also carry a separate Part D drug plan, roughly $30 a month on top. Buy it early and it's cheap protection. Buy it late, and it may be expensive or unavailable. Medicare Advantage is a managed care product, usually an HMO or PPO run by a private insurer, that replaces original Medicare as your primary coverage. Per CMS and KFF 2026 data, most MA plans charge $0 additional premium beyond the standard Part B premium, with the average MA premium around $14 a month. It suits healthy, low-utilization retirees who want low upfront cost and often bundle dental, vision, and drug coverage. Unlike bare original Medicare, it does include a built-in out-of-pocket cap. The trade-offs, networks and prior authorization, only bite when you actually need a lot of care. Advantage's best case is genuinely strong, if you stay healthy. Based on 2026 cost modeling, a low utilization enrollee can save roughly $1,200 to $2,400 a year versus Medigap plus Part D. Run the numbers on a healthy 65-year-old, and the all-in advantage cost lands around $3,000 to $3,600 for the year, against about $5,025 for the Medigap Plan G path. That's real money kept in your pocket every year you don't get sick, plus extras like dental and vision that Medigap simply doesn't cover. The question is only how long that healthy streak lasts. Advantages catches the number the ads bury. CMS caps the 2026 in-network out-of-pocket maximum at $9,250, and KFF found combined in- and out-of-network exposure averaged about $8,707 in 2024. A stroke, cancer diagnosis, or complex surgery can push you close to that ceiling in a single year, and prior authorization denials plus appeals add friction right when you're sickest. That $9,250 is roughly 20 to 40 times a Plan G enrollee's typical yearly exposure of $240 for covered services. The zero premium is real, but so is that ceiling. Let's score the money criteria directly. On monthly premium, Advantage wins easily, about $14 average against Plan G's $165.85 at 65 per CMS and KFF, but worst year exposure goes to Medigap in a landslide, roughly $240 versus up to $9,250. For a healthy person, all-in annual cost favors Advantage at $3,000 to $3,600 against Medigap's $5,025. Flip to chronic use, and it reverses hard. Medigap holds around $5,000 to $5,500, while Advantage climbs to $7,000 to $9,000 a year, based on KFF out-of-pocket data and chronic care modeling. Now the non-money criteria. On provider access, Medigap wins. You can use any doctor or hospital in the U.S. that accepts Medicare, with no network restrictions, according to CMS and KFF. Advantage limits you to a network and layers on prior authorization, which can delay or deny specialist and out-of-state care. But Advantage takes the perks round, since many plans bundle dental, vision, and drug coverage that Medigap doesn't include. If this breakdown is helping you, subscribe. The next one is already coming. Tally the rounds and it's close on count but lopsided on stakes. Medigap Plan G won 4 categories: worst year exposure, chronic use cost, nationwide access, and no prior authorization. Medicare Advantage won 3: monthly premium, healthy person all-in cost, and bundled perks. The rounds Medigap wins are the ones that matter most when your health turns, while the rounds Advantage wins matter most while you're well. Before I get to the verdict, which is the most counterintuitive piece of this, here's the single number that decides it for most people: $9,250. That's the 2026 in-network out-of-pocket ceiling under Medicare Advantage per CMS, and your real question is simply how likely you are to hit it. If you have chronic conditions or expect heavy specialist use, you'll brush that ceiling often, and Medigap's $240 exposure wins outright. If you're healthy and low use, you may never touch it, and Advantage's premium savings win instead. So who wins? Honestly, it depends. And here's the clear rule. This is general information, not personal advice. So check each plan's details and your own health and budget before deciding. If you're a healthy, low-utilization retiree who values the lowest premium and bundled perks, Medicare Advantage is the better fit. A person like that can save $1,200 to $1,400 a year versus Medigap plus Part D per 2026 modeling. But if you have one or more chronic conditions, see specialists regularly, or want the freedom to use any Medicare provider nationwide, Medigap Plan G is the better fit, running $3,100 to $5,400 a year cheaper for that profile and holding covered service exposure to about $240. The counterintuitive part, the healthier and richer you are, the less you need Medigap. Yet the moment you develop needs is exactly when it becomes hardest to switch into. Here's the clean decision guide. Choose Medigap Plan G if you have chronic conditions or heavy specialist use. If you want to see any Medicare provider nationwide with no prior authorization, Or if you value a predictable, capped worst year over a low premium. Choose Medicare Advantage if you're healthy and low utilization. If the lowest possible premium and bundled dental and vision matter most to you. And if you're comfortable trading network limits for that saving. And whichever way you lean toward Medigap, act inside your 6-month Part B open enrollment window. After that, underwriting can raise the price or block you entirely, per 2026 research. Next, I'm covering the Medigap enrollment timing trap, the 6-month window most people don't know they're burning, and exactly how underwriting quietly reprices you once it closes. If you want to catch that one, subscribe so you don't miss it. Getting the timing right can be worth thousands over a 20-year retirement, and it's the piece almost nobody plans for.